For decades, most people believed the dental industry was primarily controlled by clinicians. But over the next 10 years, some of the most influential organizations inside dentistry may not necessarily be the ones performing procedures. They may increasingly become the organizations coordinating the infrastructure behind them. And that infrastructural layer may quietly become one of the most valuable parts of modern dentistry itself. In previous videos, we explored CBCT imaging, digital workflows, AI-assisted diagnostics, dental laboratories, cloud coordination, and the growing role of software ecosystems inside dentistry. But when all these systems begin connecting together, a much larger strategic question begins emerging. Who will coordinate the entire ecosystem? Because once dentistry becomes deeply digital, the organizations coordinating those workflows may begin gaining enormous strategic influence. Historically, most value inside dentistry was concentrated around individual clinicians, procedures, and private practices. But digital dentistry may gradually redistribute part of that value toward entirely different players. Organizations such as DSOs, dental service organizations, software companies, imaging hubs, cloud-based workflow platforms, AI diagnostic systems, centralized planning centers, digital laboratory ecosystems, and even referral coordination networks may increasingly begin influencing large portions of the digital workflow ecosystem over time. Now, consider what now happens during many modern dental workflows. A single patient case may involve intraoral scanning, CBCT imaging, STL generation, smile design, implant planning, surgical guide production, CAD/CAM manufacturing, AI-assisted analysis, and cloud-based coordination. At that point, the procedure itself may no longer be the only valuable component. The coordination layer behind the workflow may become increasingly valuable as well. Because whoever controls the data flow, the workflow integration, the cloud coordination, the AI systems, and the interconnected ecosystem may eventually influence how large portions of dentistry function digitally. This transformation may begin resembling what happened in other industries. In technology, some of the most powerful companies eventually became platform coordinators, infrastructure providers, cloud ecosystems, and operating systems, not necessarily the companies manufacturing every individual product themselves. And dentistry may slowly be entering a similar phase because digital workflows naturally create network effects, centralized coordination, infrastructure concentration, and scalable ecosystem models. For example, a regional imaging ecosystem coordinating dozens of clinics, centralized treatment planning, AI-assisted diagnostics, laboratory integration, and cloud-based workflows may eventually become far more strategically influential than a standalone clinic operating independently. In many modern cases, multiple specialties may now operate simultaneously inside the same digital ecosystem. For example, orthodontists, periodontists, implantologists, prosthodontists, oral surgeons, endodontists, laboratories, and imaging centers may all increasingly coordinate through interconnected digital workflows. CBCT imaging, intraoral scans, STL files, AI-assisted diagnostics, smile design systems, and cloud-based planning platforms may eventually allow multiple providers to collaborate inside the same coordinated treatment environment. And this may become especially important for multidisciplinary clinics because once multiple specialties begin operating together digitally, workflow coordination itself may become extremely valuable strategically. A centralized infrastructure layer capable of coordinating diagnostics, treatment planning, imaging, laboratory integration, cloud communication, and interdisciplinary workflows may dramatically reduce fragmentation across the larger clinical ecosystem. This may especially impact dental laboratories, because many labs are no longer functioning only as fabrication centers. Increasingly, they are becoming digital workflow coordinators, CAD/CAM ecosystems, software-driven environments, cloud-connected manufacturing hubs, and integrated planning platforms. Some modern laboratories now coordinate STL workflows, smile design, implant planning, scanner integration, cloud communication, digital manufacturing, and AI-assisted case preparation. At that point, the laboratory itself may begin functioning more like a technology platform than a traditional fabrication center. Artificial intelligence may accelerate this transition even further, because AI systems may increasingly assist with diagnostics, segmentation, treatment simulation, workflow optimization, case organization, and predictive planning. And as AI becomes more deeply integrated, the organizations coordinating those systems may gain even greater influence inside digital dentistry. Another major shift may involve referral concentration, because digital infrastructure naturally encourages centralized workflows, interconnected provider networks, and scalable coordination systems. Over time, organizations capable of coordinating imaging, planning, laboratories, AI systems, and cloud workflows across entire referral ecosystems may gradually accumulate enormous strategic advantages. Ultimately, this may become one of the biggest structural transformations modern dentistry has ever experienced. Because dentistry may no longer function only as independent clinical practices, isolated workflows, or disconnected providers. It may increasingly evolve into a coordinated digital infrastructure ecosystem. Ultimately, the organizations shaping the future of dentistry may not simply be the ones performing procedures. They may increasingly become the organizations coordinating the workflows, the software, the infrastructure, and the digital ecosystems connecting the entire industry together. And over the next decade, that hidden infrastructure layer may quietly redefine how modern dentistry operates at scale. In upcoming videos, I'll begin exploring how scalable imaging networks operate and why workflow coordination may become economically powerful, and also how multidisciplinary digital ecosystems may reshape the business architecture of dentistry itself. Thank you for watching, and I'll see you in the next video.